Good morning, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. My name is Tanya Lowry St. John, and I'm the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW. We're going to use the next 30 minutes to talk about our sister website, Hawaii Health Matters, and how to manipulate graphs and maps within the system and download data from Hawaii Health Matters, or HHM. The presentation should take about 20 minutes, and then we'll have a few minutes left for questions so that we finish up in half an hour. For everyone's comfort, participants will be muted during the presentation. Please post your questions in the chat box, and Rico Lee, our graduate research assistant, will collect the questions and ask them at specific points during the presentation. This webinar will be recorded and will be posted to our YouTube channel for future reference. A link to the webinar will also be emailed to you once we get it posted. So Hawaii Health Matters website, or HHM, is the sister website to hhdw.org. HHM was designed to provide a friendly way for users to access and interpret health data, and it houses over 650 indicators of health from more than 50 different sources. These include indicators of individual health, like the number of people % that smoke or who have high blood pressure or obesity, so personal health, but also of community health, so information about the demographics of a community, like crowding and income, education, environment, economy, and transportation, a lot of what we would consider the social determinants of health. So the reach of HHM is broader than HHGW, and some of these indicators are maintained in the site by Conduent Healthy Communities Institute, which is the platform that we're using for this site, but the bulk of the health indicators are maintained by HHGW using data from the Hawaii Health Data Warehouse. HHM was originally designed with the state and county data in mind, so almost all indicators have data for both, and many have additional data by other demographic variables like age and sex and race ethnicity. Moreover, HHM contains some sub-county level data, all the way down to the census tract for some indicators, and we'll be exploring some of that in the mapping today. When you think about the indicators, it's helpful to think of them as separate objects or books within a library. So those indicators, those 650 indicators, can be viewed individually. They can be grouped in a form like a pre-made tracker, like we've created in the warehouse. For example, our Pan Plan tracker or Healthy People 2020 tracker, or as a hand-picked tracker, as a custom one that you can create and share. And we did that in a previous webinar. Today, we're going to focus on configuring and exporting graphs and maps in HHM. Before we get to the site, I want to quickly review some of the icons you will see. So one of the foundations of HHM is to provide the data in context. So here is the estimate, but what does that mean? How does it compare to the nation or to how we've done in the past or to other counties? So to help make this clearer, HHM uses a series of icons as part of the display. As a rule of thumb, the direction of the arrow indicates whether it's going up or whether it's going down, and the color tells us how to interpret it. So red is bad, green is good, and blue is neutral. For trend data, mostly solid icons indicate a statistically significant trends. So this one would be statistically significant trend that's going up, but it's red, so it's bad that it's going up. And mostly white trends are trends that are not statistically significant. The trend is there, but it hasn't reached significance. So here we have information about children and senior citizens who are living below poverty level. In the first indicator, 12.5% of children in Hawaii live below poverty level. In parentheses, you can see that this measurement is from 2014 to 2018. The gauge is, which you might not have seen before, shows where we fall in comparison with the distribution of children living in poverty in the US. So the green piece is the top 50%. So these are the lowest states. So we're among the lowest. And the next one will show you that the US value is actually 19.5% of kids in the United States live below the poverty level. We're lower than that, which is a down arrow, and that's good. So therefore it's green. Compared to Hawaii's prior value, which was 12.9%, there is no difference, so it's blue and neutral. But there is a upward trend. The percent of children living below poverty level is going up over time, but not significantly. So it's bad that it's going up, it's red, it's not significant, it's mostly white. So to get to Hawaii Health Matters site, you can either go ahead and type directly hawaiihealthmatters.org, or you can start at hhdw.org and navigate from here. I recommend that if you have two screens, that you go ahead and follow along. So you can click here on this big green button, or you can also click on the hyperlink above, and that will take you to our hawaiihealthmatters.org site. And this brings you to that HHM homepage. As you might recall, we have our rotating banner, which will have our featured content. This month, it's the Kids Count Data Book, which is then linked to this mini dashboard below on the site. It lets you know that the most recent data we've loaded into Hawaii IBIS is the death module, and you can also go ahead and sign up for a coffee break. This time I want you to keep scrolling down on the screen, and you'll see our site features. So here's some of our trackers that we're featuring, a link back to the Hawaii Health Data Warehouse, the Socio Needs Index, which we'll be covering in a future webinar, and then also some ability to do comparisons of data, finding local reports, and then our demographic data that we looked at briefly during a previous webinar. In our last webinar, we talked about the health topics function within Hawaii IBIS. Here in Hawaii Health Matters, we have a health topics centers. And so we have data, as we mentioned, about health, but also about the economy, education, environment, government and politics, public safety, the social environment, and transportation. So together, a lot of these will make up the social determinants of health. If you click on a topic area, you'll come to a page that shows you lots of buttons. So we have indicators, we have promising practices, 211 resources, articles that we might have, CDC, a whole bunch of different resources regarding health. If we, for example, we're going to collect here on indicators, you'll see it'll give us a list of 6, but tell us here that there's actually 554 different health indicators related to the health topic here within HHM. We can either go down here to go to a different topic center, but we can also use this scroll bar here and to go through if we want to then maybe subset health and only look at a part of health, or we want to look at one of the other topic areas. They are all further broken down into some different subsets of that topic area. Today, let's navigate to transportation. And here you can see that there are fewer buttons, so the number of buttons will depend on the topic area. You can see that we have some reports regarding transportation in terms of traffic safety, bicycle plans, master plans for pedestrian and bicycle riding. We have other data resources regarding transportation. There are promising practices. So these are practices that other communities have done regarding transportation. We have, again, 6 displayed here, but there's actually 111 different promising practices regarding transportation within Hawaii Health Matters. But we're going to look at the indicators today so that we can play with some graphs. So here again, you'll see if we click on indicators that we have transportation related indicators. So hospitalization rates due to motor vehicle collisions, travel time to work, commuting information. I'm going to click here to get an idea of all the information that we might have. Again, you'll see really fast, you may have seen that it showed us it has already built its own customized dashboard for this. And you can look and you can see that we have 9 different indicators, and these are the names of the indicators. Each of these will bring you to the indicator itself, and these are the geographies for which we have information. So we have at the state, county, primary care service area, census place, city, zip code, and census tract level data. So let's go ahead and take a look at workers that commute by walking to work. This brings us to a selection page. You wouldn't have seen this if you enter into it, depending on the path you take to get to the indicators. There's a lot of ways to find data into the system. But the first thing they're going to want to know is what geography we're interested in. So we're going to say we'll look at state data to start with. And this brings us to our standard indicator report. So we have the title, it's workers commuting by walking, and we have the ability to change the geography. Here we're looking at it for the state, but we could look at it by counties, by the census area, zip code, and all the way down to census tract, as we saw in the previous page. And the measurement period that's being covered, it's 2014 to 18, but we could also configure the measurement period for this. The definition is the percentage of total trips to work made by walking. And why is it important? Well, it's important because while walking to work is a really good way to exercise, It also helps you get in touch with your community. It reduces commute costs. It protects the environment by reducing air pollution from car trips. And studies have shown that walking to work improves employees' overall attitude and morale. It even reduces stress in the workplace. So there's some important health benefits to walking besides just the physical activity benefits. The first line is going to give you the information. So the point estimate for this period of 2014 to 18 was 4.5% of folks surveyed commute to work or total trips are made to work by walking. And that data is from the American Community Survey. There's the measurement period. This data piece is maintained by Conduit Healthy Communities Institute, and it was last updated in March of 2020. I see these gauges again, and if I don't remember what they are, it's okay. You can just hover over them. So again, you can see compared to the United States, we have a value of 4.5%, which is in the best 50% of states. So that's why we're very green. And then it tells you where the cut points are for the yellow and the red. Again, compared to the United States as a whole, compared to the prior value, we're about the same. It's going down slightly over time, but that's not statistically significant. We have met the Healthy People 2020 target for walking to work, which is 3.1%. We have not met the physical activity and nutrition plan target for walking to work, or the PAN plan target, which is 5.1%. So this is our icons, and this is our little bit of a data and context. So we can come down and we'll look at our graphs. We have the ability to look at the data for this indicator by data over time, but also by subgroups. And the same rule of thumb in terms of colors that we talked about before will apply here. So we can look at the data over time. We can look here and we look at workers commuting by walking by age group, and you can see that younger workers of 24 and less are much more likely to commute to work by walking than older workers. So they're green compared to the olders that are red, which are less likely than the population as a whole to commute to work by walking. We can see that there is no difference. It's neutral for commuting to walking by work by sex. And we can look down here under race ethnicity, and we can see that some are the same, some are doing better in terms of commuting to work by walking, and some are doing worse compared to commuting to work by walking than the population overall. We can now go up and we can then look at configuring some of these graphs. So we know that if we hover over a data point, we get the information behind that data point, but you'll also see that these little 3 bars have appeared on the side. If I go and I click on that, it allows me then to configure this graph. So I can say, let's see if I want to look at the confidence intervals regarding this. So then you can see, I can see why they're saying it looks like it's going down slightly, but it's not statistically significant because there's a lot of overlap in these confidence intervals. Or I could say that, I'm having a hard time understanding these confidence intervals because this graph doesn't begin with a zero-based y-axis. So I can click on that. And now I have workers commuting by walking with a zero-based y-axis for the state of Hawaii. I like this graph. So let's say I want to use it someplace else. I can go ahead and click download this JPEG, and it will download the graph for me. And I should be able to click on it. So you can see then it's exported a graph that will have its workers commuting by walking for the state of Hawaii. The source of this graph came from the hawaiihealthmatters.org. You can see that it has both the point estimates and the error bars over time, and that the source of the data is the American Community Survey, and the most recent source is 2014 and 2018. So this is a JPEG file that then you can then dump into any report or something that you want to use. You can also export the file as a PDF file. You can download this data as a CSV file if you'd like. I'll show you what it looks like, but I'm going to recommend that if you really want to get really good data, that I wouldn't download it from here, because what it will give you is it gives you a subset of the data. So you just get the percent of the data and you'll get the confidence interval information. If you wait and download this data here under Download Hawaii Indicator Data, you will actually get all the data that's in this whole page. So then you can do a lot more things with it. With the data here, for example, for this chart, you can go ahead and add confidence intervals and so forth. And as you make your changes to the chart, that is what will export for you, is the chart as it is, not what you're seeing there. So this is, if you download the whole data set, you can actually get the data over time. You can get it by the age and gender. You can get it all the data points by year. So if you really are a data wonk and want to play with it, I would recommend that you download the data from this point here, as opposed from data from each individual graph. But if all you need is the data from the graph, then this is the way to go. So this is one way to play with the graphing functions here in HHM. So I'm going to go down and I'm going to go and take a look at this mapping section. Right now, it's really sparse because we're just looking at the data by the whole state. But I can go ahead here and click on looking at the data by counties, and I get this panel. So this panel has 3 different pieces on it. It has a map function, it has a chart function, and it has a data table. These 3 are interrelated, so that if I hover over the city and county of Honolulu here, I get the underlying data. It's highlighted in the data table below, and it's also highlighted in the map. Same thing here if I come to Maui, if I come to Hawaii. So these things are interrelated, and this will become more important as we get to smaller and smaller breakouts of data. In the map function, I can go ahead and expand it. And if you do this, then the other data will configure itself below, but I have some ability to do some changes in the map. Of course, I can zoom in and zoom out. I can go ahead and add data labels to the map. I can change the background, but that's honestly not very exciting. I've got 3 background options. I can change the transparency of the map, and that might be important when you're looking at some of the more detailed maps, if you want to look at some of the geography details underneath. But this is how I can look at the map this way. I'm going to go ahead and make it smaller. And one of the things that I can do is that I can now select how I want to compare the map. Right now it's ranked. So if we divide these up into ranks, they would rank out this way. I can look at the data and compare it to counties across the United States. So if I look at workers commuting by walking across the United States, Honolulu, Hawaii, and Maui County are all in the top 50th percent. Kauai County is in that 25th through 49th percentile down here. I can look at the data by Hawaii state value, which is 4.5%, and see how we're doing and see that one is doing better than the other 3 counties. I can look at it compared to the US, and again, we'll see the same thing. I can look at it compared to the prior value. So have we had a big change since the last measurement? And you can see that there is no change. It's no significant change since the last measurement. I can look at trends over time. So over time, Kauai is getting a little bit better, but it's not significant. Hawaii Island is getting significantly worse over time. Maui and Honolulu are getting worse, but that difference is not significant. I can also compare it to national health goals, so the Healthy People 2020 target, and see how we're doing. I compare it to the PAN plan target, and again, we can see how we're doing. And as I create any of these changes, so if I want to compare ourselves to US counties, or let's go with the Hawaii state value, if I decide that I want to export this map, those comparisons that I've put in there are going to export with it, along with all the detailed information. So now I have a map that I can throw in with comparison data. I can do the same thing with this graph as well. So it's just a neat little function to be able to take to throw these things in. We can look at the data by census places, or this is mostly cities. So this is also another way. So if I know the city that I'm interested in, and here's where it becomes a little bit more helpful, the way the maps are interconnected. So I can highlight here and see them underneath as they go. I can also maybe decide that I want to look at the data here at my data table. So I can sort them, and then I can look at them this way. So I can see that the folks that are most likely to commute to work by walking live in Laie, followed by the folks over there at Schofield Barrack and Kaneohe, so at Kebe, then Hanalei, Eden Rock. So I can kind of go through and look at the data this way. I can also go and look at the data by zip codes. And again, as you go through here, you can take a look. You can see that there's quite a difference in terms of these are the folks that are like up to 70% of the folks are by zip code are commuting by walking. I can look at the different ways of the way I want to compare this value to, and I can go all the way down to census tract. So for here now, let's just take a focus in on Hawaii County. So if I want to compare this value to Hawaii County, then what the map does is it shows me this is Hawaii County's value at 2.3%. And then my red bars are the zip codes that are below Hawaii County's level. And then my green bars are the ones that are above Hawaii County's level. But this might be a little confusing. So I can actually come up here and I can filter and say, I just want to look at among Hawaii County. And now I can look at the data by zip code. I can go ahead and throw those zip codes on there, and I can produce a map that looks at which of the Hawaii County zip codes are doing better or worse than the county as a whole in terms of commuting to work by walking, if I was going to try to do a program along there. So this is just sort of a fun way that you can go through and play. If you are really interested in, for say, one of these zip codes or places, if you go through and you can click on them, and it will actually bring you into the more detailed data regarding that geography. You can play with the geography up here, and you can do some fun things. So it's a really neat tool to have that can help you in your work and to export data to be able to use it. Are there any other questions?
Yes, there is
Okay.
one question. Is it possible to save searches?
Yes. So if, for example, when you're in here and you found something that you like, the easiest way to do that is probably going to be to go back and do as we did the last time when you create your own dashboard. But if you like this way, go ahead and just take that link and save it. And that link will pull you up this screen the way it is. So you can just save the hyperlink, because the way that they do it is they do indicator ID, how it's compared, and the location and everything else will give you this link. It may give you the most recent period of data that would be a default. You may have to go back, but if you save your link, that would be the way to do it. That's what I had to share with you guys today. I really appreciate your time. We are going to meet again instead of the first Tuesday of the month for January. We're going to make it the second, because I figure everybody's going to be really busy with their post-holiday time period. But we are hoping to have for you the 2019 Youth Risk Behavior Survey data for then. And if not, we'll come up with something else or we'll postpone. So with that, I wish you all a very happy and healthy holiday season. I hope you take some time to explore the mapping functions within Hawaii Health Matters. If you have any questions, you can send them to me at profiles@hhtw.org, or also you should have my direct email address in your confirmation for today's session. So thank you very much.